good to bring back a returning guest to the program. Glad to have him back with us, Brian Ritter, who's a VP Exchange Sales for WEX Health. Brian, welcome back.
Well, good morning, guys. How are you doing?
We're doing great. You coming to us from Nebraska?
Absolutely, yeah, Omaha, Nebraska. So spring has sprung, the flowers are blooming, and it's a good day here in Nebraska.
That's great. Well, Brian, we got a lot to talk about here in this segment in a limited amount of time, so I want to kind of kick off and give us you were part of Benaissance. It was acquired by Evolution1. Now, and WEX acquired Evolution1, I think, about 18 months, 24 months ago, and now we got a new brand around this called WEX Health. So give us a little update around all of that and the reasoning behind it and where this is going.
Yeah, absolutely. So the last time that I had a chance to visit with you, I was with Benaissance, and the desk did not change, the role did not change, but affiliation of company names have certainly evolved. I'm really, really excited about it. Evolution1, which you mentioned, was acquired by WEX, and WEX, founded in 1983, is a leading card platform and payment transaction platform that initially was focused on fuel and fleet management. In the last few years, as they've diversified, they've chosen, and I believe chosen wisely, to get in the healthcare space. And so they purchased Evolution1 in July of 2014. And Benaissance was a long-time industry partner with Evolution1. We often called upon many of the same clients, but we sold different products. Evolution1, account-based, consumer-driven accounts, FSAs, HRAs, HSAs, and of course Benaissance in their premium billing and payment collection side. So we've worked alongside them in the marketplace for many, many years, and through their new relationship with WEX, they decided they wanted to become bigger and better. We welcome that opportunity to become bigger and better, and so now we're part of the WEX family working with Evolution1. Yeah, the other great thing is we just had our annual partner conference earlier this month in April down in Scottsdale, and we had over 500 participants there, where, in fact, we rebranded the entire operation from being Evolution1, and now it's WEX Health. So new story, new brand, but some exciting new information to build upon.
So what's the partners' reception to that? Both your customer base that's now under the WEX Health and both Evolution1's now WEX Health partners. What's been the reception to this new brand and new initiative?
Candidly, it was, why didn't you guys do this sooner? It's actually been very, very warm, the reception that this news got. The partners oftentimes were using both of our native platforms in serving their business, and they see now that here is the opportunity for them to get even more services from providers that they trust. So very, very exciting. They're also interested in seeing how we might be able to leverage and integrate our solutions to bring some real neat solutions to the marketplace, one of which I hope to share with you in a little bit.
Yeah, let's talk about that now, because I think, the work that you are doing at WEX Health, and specifically around, where you come from around consolidated billing and back-end administration, I think is incredibly important. And, Brian, you've done a great job speaking at our events. We've had great discussions in those share sessions. But, talk a little bit about not just what you're doing, but the importance of the back-end in an exchange environment.
Yeah, well, thanks for that question. That back end sometimes is the forgotten end. It's not the sexy end, but it is a great way for both the exchange experience for that consumer or that employer to receive all the benefits for which they are paying onto one easy and consolidated bill. So they can receive it, it's accurate, they can make that one payment, and that payment goes to proper destinations, be it carriers or other providers. And it really is just the embodiment of consumerism. That consumerism has that first major step, that I as an individual am important, that I as an individual can have greater access to greater offerings, and that I as an individual can be facilitating that process with the greatest of ease. So if we're able to put that all those products onto one bill for that individual consumer or that employer and then make them enabled to make a payment, and we take care of the back end, it really, really goes quite well. Now, for the exchange, boy, that message out to that individual or that employer on that monthly basis reminds that individual employer that that exchange is a real key advocate in their ongoing interaction with health. And, it's really funny because we've been doing this for a long time as Benaissance, but the long-term tagline of Evolution1 and now WEX Health really comes home, and that is simplifying the business of healthcare. And that's what we do.
Yeah, it's so important. I mean, I think we can all talk about on the front side of creating plans of choice. I mean, that sounds really good, and it is where we need to be going. But if you can't, from an employer's perspective and a consumer perspective, turn that into single billing and clear ways to administer that, then there's a lot of confusion and a lot of challenges for it. That
there
you're
sure
pointing
is.
out. Yeah.
There
Talk
sure
a little bit
so,
about what you mean by pre-reconciled invoices. What do you mean by that?
Well, interesting term that I guess perhaps we coined through talking to a number of health plans of the insurance carriers. Now, this may not be true with the largest 5 or 6 health plans, but as we're talking to employers and to health plans, there's this iterative dance that goes on between the health plan that is sending out an invoice to the employer, and the employer attempts to receive it and say, my gosh, I'm supposed to pay this as billed, and yet the census information I'm being presented by my insurance carrier does not really reflect my census here presently working at my organization because there's been changes. So in talking to those carriers, we were floored to learn that as they produce those invoices, they know that oftentimes they are very similar to the phone books, that as they're being printed, not even distributed, but as they're being printed, they are out of touch with the actual census. And so they just kind of go along with this existence of this multi-iterative process between employer and health plan to figure out who's on first, what's on second. So pre-reconciled. What we do, because we're doing the consolidated billing based upon the enrollment system, we're taking an up-to-minute snapshot of that employer's census. So by pre-reconciled, we're taking the very much latest and greatest down to a minute-based moment to send out that invoice on behalf of the exchange through the employer census. So it really gives a great, clean starting point for the employer to go through their bill and to see what changes might need to be made. And that's where we wrap around that concept that we've coined as review and repair. We're going to push out that invoice. It's pre-reconciled, and we're going to poke the employer the first time. We're going to give them an opportunity to review that invoice. They can make changes, and then we're going to send them a final bill perhaps several days later, whatever that carrier or that platform wants to support, several days later, such that they can pay with as much reconciliation process having taken place to ensure maximum accuracy and least amount of post-payment reconciliation as possible.
Hey, Brian, when you talk about review and repair, is that only for fully insured? Is that also applicable to self-funded plans?
It applies really to both, because obviously in the self-insured model, most of the large employers are working with some sort of a TPA that is charging them on a per-member, per-month basis for either supplying them a network or doing claims processing. So that TPA or the insurance carrier certainly knows who they are supposed to be covering from that time period, either real-time at the point of sale for services such as prescriptions or on a post-service basis such as claims processing. So that this concept of accurate census, accurate billing, and review and repair really does extend to both populations.
Let me ask you, I want to talk about your retirement premium billing in a minute, but first I want to ask you a question about the exchange environment, because you're front and center with that. And, we're still in the early days, as we all know. Some people say we're still really at the beginning, and technology is maturing. Do you see the exchanges embracing the need to have this important back end? Where do you see their mindset and what they're trying to do?
A fair question. what we see is the answer is yes. We see there's continued interest and continued commitment to move to embracing a full exchange experience for the individuals as well as the employers. Certainly, it may not be happening as quickly as we, as a evangelical missionary out talking about consolidated billing, would like to see, but we are seeing great traction in it. We realize it's going to be more of a marathon as opposed to a sprint. But ultimately, as we get down to the key concepts of consumerism, so if we step back and look at those small step-by-steps, if we some days get frustrated, we look back at that meta concept where individuals are more responsible for their health care. They have greater choice. We see that the small actions taken each and every day are really just the creation of an ongoing, growing movement to embrace these elements that make those exchanges far successful. So we're seeing traction in different pockets. You mentioned the retiree space. We see it as really a great cutting-edge application of what we can do. May I share with you what we're doing there?
Yeah, absolutely. I'd like to hear about that because I think a lot of movement around retiree to employers to look at the retiree benefit population and how they change that up. And I think exchanges are a definite alternative there. But yeah, talk to us about what you're doing there.
So this is a great manifestation of what WEX Health, combining native Evolution1 and Benaissance underneath the brand of WEX Health is doing. I believe it was last year that one of the leading benefit consulting firms announced a study in which they looked at employers and effectively said about 1/3 of employers who had retiree populations that they were serving were already on some form of a private exchange. And yet another 60% saw private exchange as being a part of their long-term future. Now, in that today, retirees on these exchanges getting their benefits, it's a great transition because they're able to save money, both the employer but also the individual retiree, but in many cases is not exactly user-friendly yet on the back-end side. What do I mean by that? Well, today, if that retiree signs up for a couple different products, and let's just say it's a medical supplement and a dental, they're going to get multiple bills from each carrier. They're going to write out that check for each bill. They're going to mail it to each carrier. They have to make a photocopy of it and to send that in subsequently to their employer or their employer's administrator to get that reimbursement check from their health reimbursement account. And then retiree is waiting for that check to come in, and they're waiting for that check to come in, and finally they get paid. So it's a process that is not different than what most folks have incurred previously, but it's not necessarily clean, especially for this segment. So how we bring in solutions from WEX Health, we're doing a couple things. Because Evolution1 historically had consumer-driven health leadership in terms of HRAs, HSAs, FSAs, and Benaissance has that consolidated billing and payment collection, here's how we're tying that together. One, retiree through their exchange gets one bill, not two. Instead of that retiree having to write out all these checks and then wait for reimbursement, we are making it easier. We're taking that amount that they owe, we're netting it against the HRA that is in our platform. We are then, if the individual does have any remaining balance, we're sending one invoice for them. They're making one net payment, not waiting for any reimbursement, and then we'll take those funds and then send them on to their ultimate destination. So in essence, we have cut quite a bit of the cycle out of the process for the retiree. We've cut out a lot of the noise, but most importantly, we're not having that retiree write a check for money and then wait for their reimbursement to come in. That's a huge game changer, and we're thinking that in early adoption, what we're seeing will certainly become perhaps a de facto model of serving this population.
That's good stuff, Brian. Well, Brian, we've got a couple minutes to go here, and I always like to leave you with an opportunity to kind of close out this segment and leave our audience with some takeaways and how they can reach out to you.
Well, absolutely. Thank you. Well, the biggest takeaway is please remember our brand, WEX Health. Anytime you change your brand, there's always a lot of education, and we're going to have to message that quite a bit. So WEX Health is a home that you would find natively Evolution1 and Benaissance solutions, although candidly those names have gone away, and we are WEX Health. The other thing is really, if anyone out in your audience, whether it's the employer or the exchange or a carrier, is looking for solutions that can really leverage their interest in consumer-driven health accounts as well as consolidated billing and payment collection, please give us a call. And they can certainly find us at WEXHealthInc.com, or just Google WEX Health and they'll find it. And if they have an edge case that they're concerned about, they're wondering, hey, we have a need to solve, and it involves, again, billing and accounts, give us a call, and we're happy to tackle that issue and see together how we can solution to meet that need in the marketplace. Hey, Doug, thanks so much for having me on. We're going to be there in Atlanta in just about 4 weeks, so happy to see you guys there, and we appreciate the ability to share our story with you.
Great to have you with us as always, Brian. I look forward to seeing you. And just under 30 days now in Atlanta. It's coming up on us quick. So enjoy the springtime out there in Nebraska this weekend, and we'll see you soon. And I appreciate you joining us.